This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
I'm Reed Yaris. I'm one of the chief residents here at University of Miami. Benvenidos in Miami. Edwin Amirian is going to start off with the next slide.
Hi, everyone. My name is Edwin. I'm one of the chiefs along with Reed. On the call tonight, we have Oliver, who's a PGY4. Nathan, unfortunately, was not able to log on tonight. Myself and Reed. Next slide. So you guys know the Zoom rules. I see you guys are all compliant, so that's great. So we have 4 hospital systems in our one residency program. We have the Jackson Health System, which we are hired through. We also rotate at the University of Miami Health System, UHealth, the Miami VA, and Mount Sinai Medical Center. We should note that all of our locations, except for Mount Sinai, are all on the same campus. So we'll start with the Jackson Memorial Hospital. This is where we're hired through. We have about 1,500 beds here. It's the 3rd largest public hospital in the U.S. and a teaching hospital in the USA. We have the Ryder Trauma Center and our new Lynn Rehab Center as well. Across the street, we have our University of Miami Health System, which includes Sylvester Cancer Center, Lennar Center, and our Interventional Pain Center. This is where we get a lot of our academic time as well. And then across from there is our VA Health Center, which is about 370 beds. We do spinal cord injury rehab, our prosthetic treatment center. We have outpatient MSK clinics. We do some neurotoxin clinic for migraines and spasticity. We have an interventional pain management clinic and our EMG clinics. And of course, our lovely Mount Sinai Medical Center. This is a private hospital, but there is a lot of teaching going on there. They have a lot of residency programs. And we do our one rotation there, inpatient with, one inpatient rotation during our PGY4 year, and this is located in Miami Beach. Get nice views here. So as you can see, all of our sites are located on one campus. Most of our sites, 95%. So if you see where that plus sign is, that's where the VA is. Across the street, the Heart, that's where the Lynn Rehab Center is. And across from that, we have UM clinics, which is the blue, the green plus sign. And then across from that is where the University of Miami Hospital is. So again, 95% of our sites are on one campus. Next slide. And then this is a slide just showing where most residents live. We have as far south as South Miami, and we even have residents come all the way from Hollywood. Each of these locations have a taste for everybody. I'll hand it off to Reed.
Guys, we've got a great group of leadership here. Dr. Gator, our chair, Dr. Price, and Dr. Molinaro, so PD and APD. They've both been through this program. They've helped build it throughout, and a great program manager with Caretha Davis. So we have 24 residents, 8 per class, PGY 2 through 4. We also have a lot of fellows in here. We have 2 spinal cord injury, 1 TBI, and 1 cancer rehab this year. We pride ourselves on having a diverse faculty group, most of them being board certified and individuals. We have 1 pediatric spinal cord injury and 3 with traumatic brain injury throughout. And this is one of our favorite parts, the new Christine E. Lynn rehabilitation site. I wish we could have you all here to view it and see it. It truly is beautiful. There's 2 gyms, 2nd floor and 3rd floor. It's 9 floors up, with the 9th having some room for expansion at this time. Each room is private, beautiful rooms. This is outside to the right. There's a little outdoor area there with a basketball court, grills and things like that. So we have more room for activities. It's a 72 inpatient bed. There's a separate gym in there. It's patient friendly. We have a meditation space. We really focus on wellness with these patients and an integrated patient care technology. Full size car in there, airplane seats. We work on really transitioning these patients home. Aquatic pool therapy, zero G gait and balance systems. And most of all, we have a partnership with the Miami Project to Cure Paralysis. So if you're interested in research, there's several opportunities here. Here's the pool over here. Some kayaks in there sometimes as well. So what are our strengths? We've been going on for over 15 years now. At University of Miami, at Jackson Hospital, you're going to get a diverse patient population and a diverse residency class. Early on, you're going to get exposure to procedures, whether that be fluoroscopy, baclofen training, or ultrasound training, and you're going to get the subspecialty exposure along with the fellows that are there as well. Yes, we're working on some growth here as well. It's not all sunshine down here in South Florida. The pediatric rehab is growing. We have new faculty and we have a new unit on its way. We're revamping the mentorship program, and last year we started up a dedicated research time, so you have a whole block so you're able to move forward with it. And prosthetics and orthotics is something we're developing, an educational program. We actually had our first spot last year and went really well. So I'll keep going with here. You're going to get a nice mix here with inpatient, outpatient, and electives. Inpatient, you're going to get your bread and butter with spinal cord injury, traumatic brain injury, comp, and pediatrics. Outpatient, you're going to be able to get those baclofen pump, those exposures. Your electives, you're going to get 8 weeks of electives, 4 weeks in-house, 4 weeks you could use away. People have used that to go all throughout the country or stay in-house if they want to. In-house options, some of them that you'll have here is through the anesthesia department, possibly through neuro department with headache medicine if you want to get involved with sports medicine. Prior residents have gotten involved with neurosurgery, ortho, radiology, and palliative care. So it's PGY2. This is a quick breakdown of your rotations. We won't go through it much, but as you can see, it's pretty balanced, more inpatient at the beginning, and as you move on to your PGY 4-year, you get more of that outpatient experience. Beautiful call rooms in here. Calls are pretty nice. As a PGY 2, you're going to do approximately about 18 call shifts. You're only working on holidays and weekends, and nothing over the weekdays. As PGY 3 and 4, we revamped it. It's a night float here. You get 4 total weeks, 2 weeks spread out. And that'll be Sunday through Thursday, so you're never working a weekend. And as a 4, you never work a holiday or a weekend again. No daytime responsibilities. You can see kind of this is more of a breakdown on how we've changed from 2018, where you were on call, and now it's more the night shift opportunities here. So salary is always changing. This is as of 2020, but we've gotten a little bit more of a stipend here. I think we're getting close in the 65,000 range. You also get $2,000 annually for education stipend. You'll get about $1,300 at the cafeteria. You have 4 weeks vacation, 1 wellness day. You could use it however you please. And then you get special education days to be used for conferences and some for interviews when it comes to fellowship. There's also additional funding for conferences if you're first author. And you could also go through CIR, which we'll talk about. CIR, I think it's really important. Any program you guys go to, looking to see if you have a union that's able to help you guys out. They've worked tirelessly, with the housing market going up and working to get us a little bit more money there and helping to protect us. If you guys have any questions about this, you could always email us on the side separately, and we'd love to go through it with you. Protected time. Didactics are really important to us. You're going to have the didactic time every Friday morning, but you're going to have Cucarillo Club on some days, Journal Club, Grand Rounds, really making sure that it's more than just learning with your hands, learning on the floor, but you're going to get that board studying opportunity here to really make you a better physician. We go through SAE, board studying. You'll get semi-annual mock oral exams. You'll be more than prepared to move on and prepared for the next step. Oliver, you going up on the next one, or you want me to keep going?
Yeah, hey Reed. Hey guys, my name's Oliver. I'm having trouble with my camera, but I'm gonna go ahead and continue with the with our presentation here. So let's see. It's not letting me share the screen.
Just tell me next slide. It's okay.
Yeah, okay. So this is our interventional spine course. This is a big issue for us because we pride ourselves on all the procedures we do, and we spend a lot of time here. So essentially about once a month we do different procedures, transforaminal epidural steroid injections, SI joint injections, and we practice hands-on on these mannequins using live fluoro. So by the end of the year, you've gone through kind of your bread and butter of injections. You really get a good hands-on training. Reed, Edwin, and I are both spine course instructors. Let me keep on going there, Reed, for the presentation. So the spine course is one aspect of our hands-on training. We have a monthly ultrasound course. I've actually just started last week. Same kind of a thing on a monthly, every 2 month basis. We choose one joint, and this past month we happen to do shoulder. So we do an active shoulder ultrasound examination. It's led by our sports medicine trained faculty, and we repeat this every year. In addition, we have backlift and pump workshops, and also a spasticity Botox workshop where we do similar didactic and hands-on learning. So we really, pride ourselves in getting these skills done early and throughout our entire residency. And of course, the medical students. So University of Miami Medical School is heavily involved. We constantly have medical students rotating through our departments, whether on inpatient or whether an outpatient. And so we're very involved in teaching if that's something you like to do. We also have opportunity to work in the San Juan Bosco Clinic, which is a clinic for undocumented and uninsured patients that come, and medical students play a vital role in that. And we have outside of rotating medical students that come as well to spend time with us. And so this has kind of been a revamping of the program in the past couple of years. We have this new research block, and so we have a research day at the end of the year for us. So as PGY4s, we'll all present our own original research project, typically about in May. And then we have a quality improvement day, which the PGY4s do as well. We have countless residents who are heavily involved in local, national, and international PM&R organizations. This bottom picture was FSPM&R last year, and this year I went with one of the PGY3s to FSPM&R, which is a local Florida chapter. And we're consistently heavily involved in all the conferences and represent the University of Miami very well at these national conferences and posters and presentations and research projects. Community involvement. So I've already touched on the San Juan Bosco Clinic. So we do a lot of sports coverage. Of course, with COVID having occurred, having been prevalent, we've been limited. But as we've been more able to control things, we've ramped up a lot of the sports coverage we did. So I know Reed and I both were at the Miami Dolphins Cancer Challenge, which is a local race around the Hard Rock Stadium where the Dolphins play. We had the Miami Heels Wheels team. Wadapalooza CrossFit Festival is held here in, I think, January. So we all play a role in that. And then we also kind of help out with hurricane preparedness, which for you guys don't know, hurricane season is right now, ends in November. It'll probably start to pick up soon. But we like to play hard. And then, where do our residents end up? So within my class, all 8 of us are actually applying to fellowship. We have one of us that matched not too long ago. But we go all over the country. Last year we had our residents go to Yale, Vanderbilt. We had some go to Harvard, UCLA. So we really go all over the country after graduating from UM. And of course, what is Miami, right? So Edwin and I are both heavily involved in resident wellness. We have some pictures here of Wynwood, Miami Beach. Next slide, Reed, when you show them. So I and Edwin pride ourselves in the culture we have here in Miami. We're a very tight-knit group. We love to have fun. We work hard, but we also we play hard. So we frequently go out to Wynwood, which is like a warehouse kind of graffiti art location. We go to happy hour. The past couple of years, we had a resident intramural kickball league. Didn't win, but we got close. We have weekend brunches. 2 years ago, Edwin and I spearheaded our first annual resident wellness retreat, where we all had clinical duties given off to us, and we had a whole day of education. And and then team bonding. And we repeated it last year, and we'll have it again next year. So it's a totally program funded, supported initiative that our program leadership thought was very important. And the top left is actually from our first resident wellness retreat. We went to a local state park. But, you know, here in Miami, we really pride ourselves in being a big family. And by the time you would leave, you end up having so many friends, and it's hard to see everybody go. But we have a very strong, tight-knit culture here. So, you know, top takeaways for our program, you know, really, you really get to work under attendings that are all fellowship trained in their respective field. We have a brand new hospital. All the residents that are, you know, whether in internal medicine or neurosurgery, they're constantly telling us how jealous they are of our facility. Our program is incredibly diverse. And Miami itself is a very diverse place to see. You see a lot of pathology. And our program itself is also very resident driven. So all these spine courses and interventional courses, they're all led by ourselves. The resident wellness initiatives, where we pride ourselves in working for our residents and for the program. And you really get, in my opinion, what is one of the best interventional exposures, and as well as inpatient and outpatient. It's really the best of both worlds. And I couldn't be happier with the experience and education and training that I've gotten. And I know that's true for Reed and Edwin as well. Personal experiences.
We'll skip this slide.
Yeah.
If you guys want to know more about us, please reach out. We're going to give you a different email address here. I'm going to type mine in as well. Please feel free to email us at any time if you guys have any questions. Like Oliver and Edwin said, we have a great program here. I could not have asked for a better program. I love every second of it. I love my residents I'm working with. I love the faculty that we have here. And I am very proud to be here.
About 5 minutes left in case any of the students and applicants have any pictures for the representatives from University of Miami, or questions, excuse me.
And we'll also post some, we'll also post this PowerPoint for you guys as well.
Yeah. It sounded like someone was asking a question.
Hey, sorry. I apologize if you guys already covered this, but quick question. In terms of housing, I know, you know, Miami can be very expensive. You know, what do you guys, what's kind of the typical game plan with that? You know, I know you guys covered, you know, where everybody lives, but, you know, in terms of your salaries, and then, you know, the just like the housing market, what's it kind of like out there for you guys? Thanks.
Edwin, you want to go first?
Yeah, so as many of you may know, Miami has jumped up in rent prices over the last year or so. However, it is still pretty affordable. I think our resident salaries cover pretty well. I was in a studio last year for $1,800. Now I'm in a 1-bedroom for about like $2,700. It is bigger than my old spot, about twice the size though. But it's in a different location. So, I mean, it is doable. And we're also getting a bump in our salary. I believe starting it's going to be 64 or 65 for PGY2s, rather than the 61 or 62 we saw earlier.
You don't have to live right by the hospital. That's obviously the most expensive area. But if you could see down here, we have some people who live down in Doral or South Miami, maybe 15 minutes away or so, and you could get much more land, property, space than obviously you can in Miami Beach for that. It's totally doable. All of our residents are living comfortably and enjoying their weekends.
We have another question here. Could you elaborate on the research-specific resources available to the residents?
So this is kind of brand new in our block. So as a PGY2, at the end of your PGY2 or beginning of your PGY3, you have a dedicated block that is dedicated to research. So we have a research, Dr. Gator, who's our chair, is heavily involved in research, specifically spinal cord injury research. And we have a lot of funding available. The Miami project is a big part of there's a lot of research, specifically in spinal cord injury. But as a 2 or a 3, you'll have a dedicated block dedicated to research, where you'll meet with research faculty that we have. They'll sit down with you. They'll see what interests you are. what interests you have. And among all our faculty, whether it's sports medicine trained or brain injury or stroke or cancer, all the attendings are actually almost always looking for help with whatever respective projects they have and have a lot of ideas. So if you have your own interests, all three of us actually on the call have to have a fairly large project that we present. So I have an IRB that I just got approved by University of Miami to test different dysphagia screening tools. I know Reed is working on a systematic review looking at chemotherapy-induced neuropathies, and Edwin has a project of similar substance that we're all working towards that we'll present at the end of the year. So if you're interested in research, you have it.
Yeah, one of the benefits of University of Miami is you get the University of Miami resources here. So you will have a librarian. If you want to work on things like a meta-analysis, you have a statistician to help you along with it. And you have all the faculty who's fellowship trained as well, who have been through it. You have unlimited resources.
Next question we have here is, do we have in-house fellowships? Yes, we do. We have one TBI fellow. We have 2 SCI fellows and 1 cancer fellow. And we also have a good relationship with the pain fellowship that's anesthesia based. So, or sponsored to the anesthesia department. Yeah. And we have had residents in the past match there for the pain fellowships.
And then Nilafar had a question about couples matching. I'm not aware that any of our residents have ever matched couples. Although we have a PGY3 right now who has a PGY2 and they're a couple, but they didn't match together. Not to say that we wouldn't match a couple, but not in the recent time.
Sorry, Oliver, to clarify, we do participate in couples matching.
That was our associate program director, Dr. Molinares, who's on the call, as well as Dr. Price. Have you had US IMG residents in the past? Yes, we have. We've had a couple in the last few years. So yeah, we do take US IMGs.
That's the last question we can answer for the session. Feel free to continue to use the chat feature, everyone. Thank you so much for the University of Miami for participating tonight. That was some awesome information and very helpful for everyone. The